just another minute, and actually it's 2 o'clock right now, so I'm going to call the May 5th Winnebago County Mental Health Board meeting to order. And I will at this time take the roll call. Richard Kunert.
Here.
Mary Ann Abadi, present. Dr. Edward Copeland. Danielle Angelari.
Here.
Dr. Bill Gorski.
Here.
Dr. Terry Giardini.
Here.
Tim Neighbors.
Here.
Linda Sandquist. Our advisor members, Wendy Larson Bennett and Jay Ware. Okay. As far as public comment, we've had no requests for today. Jay is here. I see Jay Ware now join. Welcome, Jay. I do need a motion for approving the minutes from the April 7th, 2021 meeting.
So move.
Second.
Dick, who's second?
I did.
Dick did. Okay. A roll call. Mary Ann Abadi, aye. Dick Cooner,
Aye.
Dr. Reverend Copeland, Danielle Angelari,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Terry Giardini,
Aye.
Tim Neighbors,
Yes.
and Linda Sandquist. Okay. And at this time, I will be reading the resolution authorizing the Winnebago County Mental Health Board funding and allocation of the grant funds for program year 2022. Here, there is some background. Okay. Whereas Winnebago County Mental Health Board published a 3-year strategic plan defining priorities and target populations for program years 2022 through 2024, and released a notice of funding opportunity for the program year 2022, requesting proposals aligned with the strategic plan priorities for up to $8.8 million of total funding. Whereas the Winnebago County Mental Health Board received 18 grant request proposals totaling $11.9 million. Whereas the Winnebago County Mental Health Board members reviewed, evaluated, and scored the 18 applications according to an established scoring matrix that was published alongside the notice of funding opportunity, and developed recommendations for funding along with work plans for each potentially funded proposal. Now, therefore, be it resolved by the Winnebago County Mental Health Board as follows. Section 1, the Winnebago Mental Health Board shall fully fund the following proposals totaling $6,202,864.22, contingent upon the execution of funding agreements and work plans. The proposals funded are as follows. Children's Home and Aid Winnebago County Doula Program. Children's Home and Aid Early Prevention in the Community, EPIC. Crusader Community Health, Crusader Behavioral Health Service expansion. Family Counseling Services of Northern Illinois, expansion of therapists, additional training, and office space. Remedies Renewing Lives, Remedies Renewing Lives Domestic Violence Program Therapy and Advocacy Project. Remedies Renewing Lives positioned to provide mental health case management services for substance abuse clients. Rockford Sexual Assault Counseling Outreach Therapist. Rosecrans Inc., Rosecrans Access to Care. Stepping Stones of Rockford, Stepping Stones Counseling Center. Winnebago County Sheriff's Office, Winnebago County Jail Behavioral Health Program enhanced. Youth Services Network, Youth Trauma Clinic, YTC. Section 2, that the Winnebago County Mental Health Board shall partially fund the following proposals totaling $2,592,358.74, contingent upon the execution of funding agreements, work plans, and updated budgets. City of Rockford Mental Health Co-Responder Program, Regional Access and Mobilization Project, Independent Living Services and Training, Shelter Care Ministry, Jubilee Member Care Coordination, University of Illinois College of Medicine, the CARE Program, Compassionate Appreciation for Recovery for Everyone. Section 3, that the Winnebago County Mental Health Board shall not fund the following proposals: Boys and Girls Club of Rockford, the Rockford Barbell Social Emotional Youth Program, Foundation Center, Substance Use and DUI Youth Education, and United Way Rock River Valley Move the Middle. Section 4, if any section, paragraph, subdivision, clause, sentence, or provision of this resolution shall be adjudged by any court of competent jurisdiction to be invalid, such judgment shall not affect, impair, invalidate, or nullify the remainder thereof, which remainder shall remain and continue in full force in effect. Section 5, this resolution shall be in full force in effect upon its passage, approval, and publication in pamphlet form, which publication is hereby authorized. At this time, I need a motion to be made for passage of the resolution.
So moved.
Dr. Gorski seconded. At this time, I'll do the roll call. Mary Ann.
Wait a minute.
I'm sorry, any discussion?
Was this something that we had a copy of, or you just read?
Yes, that was in the meeting packet that was sent to everyone before with the agenda. And it's the third page in is the resolution. And our lawyer advised us to and approve the resolution.
What was it on?
The
It's
packet,
on the,
Jason, it was with the agenda, correct?
Starts on page
Yes.
5 of the meeting packet.
meeting agenda and packet. I do have a question, just to make sure I have it in the front of my mind. Can we go over why those three were rejected really just quick? Just the crib notes of that. And then I also wanted to ask some questions about the co-responder program and the Winnebago County. It seemed, I remember the Winnebago County Jail wanted a bunch of cameras. Did we fully fund that, or were we?
Yes, that was fully funded.
See, that's, I hope we can work with them in the future, because I was hoping for something, for them to do something more novel with their monies, you know?
Jason, did you want to explain special conditions and
Sure. The special conditions that were dictated for the suicide mitigation equipment that you're referring to, Jay, essentially dictates that the sheriff's office would work with the mental health board to identify evidence-based practices for suicide mitigation in the jail. So we are not necessarily agreeing to the number of cameras that were requested, but rather stating that we will look for what the evidence base addresses as being the appropriate investment for suicide mitigation and also for the population that the jail sees. So looking at the ratio of cameras to inmate population that's recommended by national best practices, And also determining if cameras are even the actual best practice or evidence-based practice for suicide mitigation, or if alternatively there would be a better opportunity for spending those funds on different suicide mitigation strategies. That is dictated in the special agreement, special conditions in the work plan for that particular proposal.
Okay, that's good. I think I just wanted to voice this in an open meeting. For me, it's a little disappointing that they have access to funds and they decided, okay, we'll do a suicide prevention thing. And then they're not doing anything to improve the department itself in terms of its ability to deal with the public in less violent and more productive ways. And given the fact that they just had a shooting that I think should have been prevented, I need to say that out loud in public.
Okay,
And
Tim? Okay, I'm sorry, Jay. Tim
conversation
has
with
his
that
hand up.
I just wanted to answer Jay's question. So the City of Rockford program is a program that is a collaboration with Winnebago County, the City of Rockford, Loves Park, and so the program you're looking for is up under that program, and it's a collaboration of the three police.
Talking about the correspondent program, Tim?
Yeah, the correspondent program. So that's a collaboration between those three users. This particular one with the county is just for this jail by itself, and the mental health aspects that they need help with in the jail part.
Yeah, I think I understand that point. I think what I'm concerned about, what I'm disappointed in is the proposal they didn't make. They're not proposing to make their officers better. They're proposing to help with suicide of the inmates. But
I
in our
understand.
conversations, we get to push them a bit.
Right, exactly. So you've made your statement, and I want to make sure that we don't drift off of our purpose here today. A great number of hours were put into scoring each and every proposal, and evidence-based practices were considered for every proposal. But Jay, I respect that you had the platform and wanted to express your opinion, and I'm glad you did. So, but with that being said, is there any other discussion before we receive a motion to move this forward? Hearing none.
Well, I just want to say, Mary Ann, to thank everybody for all the time you've put in. I know this was a very, very thoughtful and well envisioned process from beginning to end. And I think the board deserves a lot of kudos for the hard work that they did. So
thank you, Wendy. And I thank the board for their dedication and their perseverance and their concern to, we had 5 scores, and we really tried very intentionally to communicate with each and every board member and advisors so that we would all be on the same page and get to weigh in. So I thank you all for doing that. So that being said, I need a motion for approval.
I thought
I had
we
the
did.
motion in a second already.
Okay, I didn't know if we had the motion in second.
Mary Ann, Danielle had her hand up too, I
I'm
believe.
sorry, Danielle.
Oh, I just wanted to thank Jason as well.
Yes.
Because he did
Yes,
so much.
we could not be here without Jason.
Here, here.
I think we all,
Thanks for doing that, Daniel.
yeah.
And Jason, in addition to Jason, the 3 ladies that he's working with
Mhm.
are terrific people. So
His staff.
thank you so much.
Thank you, Dick. I totally agree with that. I could not have done it without their support.
Mm.
And all of yours, of course.
Okay, since we have a motion and a second, I will do the roll call. Mary Ann Abadi, aye. Dick Kunert,
Aye.
Dr. Edward Copeland, Danielle Angeliri,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Terry Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sandquist. Well, I thank you all. That is a major accomplishment for this board. We've taken it from infancy, and I feel like today was the birth. Really. It's very exciting, and I know that the providers will be notified following this meeting of the details. So, and thank you very much, Jason Holcomb, for your dedication to our board and our
Yes.
mission and our values. Thank you.
Marianne, it's Wendy, could I just ask, will we provide feedback to those who were denied? What, led to the lower scores so that they could reapply next year?
Yes, actually, that will be explained. Jason has the calendar in terms, although Jason, did you want to speak to that right at this moment?
Sure, yeah.
Yeah, okay, why don't you clarify?
Yeah, so following this board meeting, there will be emails sent out to all of the applicants, those who were funded, fully funded, partially funded, and not funded. There will be recommendations and reasons given to those who were not funded. There will be award packets that include the funding agreement and the work plans for all of the fully funded and partially funded organizations, and a cover letter as well that was reviewed by the legal team.
Okay, and moving on to our next action item, I'm going to let Jason take this. It's a provider network building plan, and we'll need a motion once Jason explains.
Sure. So this is something that's not a new idea. We've just fleshed out the details of it, but from the outset of the grant process, there was a recognition that once we actually funded organizations, there was going to need to be a coordinating role in this. And so at one point we had talked about, and I can't remember the exact month, about the idea of a learning network collaborative, and that made its way into the funding agreement as one of the dictated requirements of funded organizations to participate in and attend learning network collaborative meetings with other funded agencies, so that there could be coordination between the funded agencies, awareness of what other funded programs there are, so there can be appropriate referrals, and also as a way that we could provide better technical assistance to these organizations for grant compliance. Having these conversations to understand what barriers and struggles there might be, giving organizations the opportunity to learn from one another. We understand that there are going to be organizations that have much more capacity than some other smaller organizations that are being funded, and they might be able to learn from one another, to coordinate efforts, to share information, etc. So that was the essential idea of this. But the component that has been added is in understanding that we also don't want to create a system where only the funded organizations have access to our information, and we kind of create this mechanism where the funded agencies have direct access to us and those that were not awarded don't, and thereby kind of create this disproportionate balance of power. So we wanted to create really an open network and a closed network opportunity. So the Learning Network Collaborative will be closed network for those that are funded. And then we've proposed having these quarterly coffee hour gatherings, whether virtually or in person, that would be open to any organization. in Winnebago County to attend and learn more about our process or specific topics that we want to highlight. And also we'd encourage the funded organizations to attend so that there's interaction between funded and other organizations in Winnebago County. So that's essentially the strategy. So there'll be quarterly open network meetings, coffee hours, and quarterly closed network meetings called Learning Network Collaborative.
Thank you, Jason. And we do need a motion for approving of this plan, the provider network building plan.
So moved.
Okay, do we have a second?
Okay.
Tim Neighbors? Okay, any discussion? Any questions?
Mary Ann?
That provider network building plan, was that in writing for us too? I
Yes.
didn't see that.
Yeah,
I saw-
the meeting packet. Everything that we're discussing today is in the meeting packet. So this
Okay, I saw it's in the execution. It goes.
page 7.
Okay.
I just, if I could make a comment, I know that we explored this before and now really seeing it play out in a time frame. I think it's just a terrific idea. I guess a matter of curiosity, did we come up with this or have other mental health boards done such a thing? Because I think it's a terrific idea from several perspectives. The idea of sharing is so important, particularly in our community that tends to get siloed. The idea of sharing and learning from one another is terrific. And I think it would break down barriers. It would create commonality of understanding. And then the added idea of not making it so exclusive, to Jason's point, that others feel like they're now behind the 8 ball for future years funding, I think is really, really important. A specific question, Jason, and the Learning Network Collaborative, like September Q1 evaluations. So we'll be working on how to evaluate the programs. And do you see that as being a openly transparent sharing of each individual recipient as to how they've been evaluated and doing that with all of them together?
So to answer your first question, McHenry County Mental Health Board does something similar to this, where they have some regular frequency of meetings with their funded partners. I don't know that they have the open network component, but what I was looking at and some of my staff working with me on this to identify network building strategies outside of just mental health boards, but looking at type like collective impact and other type of collaborative approaches to network building and how that integrates with funding and strategies that funders use to do that. So that's kind of where we came up with this idea, is like partially mental health, looking at mental health boards, and then also looking at other innovative models for network building that is kind of connected to funding.
And Bill, it was also in our culture. We did this when we built the homeless task force, beginning in the 80s and coming on through the 90s. We had monthly open meetings that all the agencies, and there were times when we had up to 30 agencies that would sit down at the table in the city hall and talk.
That's great, Dick.
Well,
I think it'll be really important for the coffee hours to make sure people understand it's come one, come all, that they don't feel that it's another extension of a closed network, that it's not just lip service. We really want other organizations to learn and come and talk about their ideas in a very open. That may need to be even promoted specifically in that way to get that kind of attendance.
Bill, the interesting thing is that I had the opportunity to speak with an organization that primarily deals with developmental disabled. However, they have co-occurring with mental illness and developmental disability. And they specifically asked me in this network if they would be able to come to some of the network meetings to learn more about the process, because, they are in Winnebago County and are very interested. And so when Jason brought this to my attention, I told him we've already had the one request.
Yeah.
And so we will be getting back to them to let them know that, yes.
It's a great idea.
Mhm.
So, in answer to your second question, the intention of the topics that we put in here were just kind of thinking out the timeline of reporting and other things that would be happening in the future and trying to make the meeting topics relevant to that. So I haven't really thought through the specific details of, you know, at that meeting in September, will all the organizations have to go around the circle and report their, their outcomes specifically, or if it's just more or less talking about what the difficulties or successes that organizations are having with how they're measuring their outcomes and reporting them, and making sure we provide appropriate technical assistance and support to help facilitate that. I think it, after the first one, we might learn more about how to best approach those meetings and kind of make them a value to everyone who's attending. I think that's the primary purpose.
Yeah, and I could see, Jason, where there might be a theme that would come out of the specific evaluations, that it's a common theme among a number of the applicants or the recipients that's de-identified, but it's discussed as a common observation that could help everyone without identifying specifically who. So again, I think that there's value to that, and we need to see how it plays out.
I'm hoping we will address Jay's concern of,
Yep.
We're going to grow what we're doing through that sharing of knowledge and understanding, so that next year we have more innovative plans.
Yeah, absolutely. I think what Jay has said is it needs to be heard. So we need to be thinking about how maybe this is the avenue, maybe there's other avenues where great proposals, great work by the board, Jason and staff, but how do we get other ideas into the mix and introduce them and let them, germinate and grow? And this may be, certainly part of the way that happens.
Absolutely.
Thank you. It's just kind of opening up the dialogue. And I mean, there is a part of me, I'm a little bit cynical that, this is something that, that's in the jail. This is something that they wanted to do. They didn't have it in their own budget. They saw this as an opportunity to fund something that was an old idea, not something that was a new idea. So, but it's a discussion, but we just have to find a way to have it.
Yep.
Okay. I will take roll call given for the approval. And Mary Ann Abadi, aye. Dick Cooner.
Aye.
Dr. Edward Copeland. Danielle Angileri. Danielle.
Aye.
Dr. Bill Gorski.
Aye.
Dr. Terry Giardini.
Aye.
Tim Neighbors.
Aye.
And Linda Sandquist. Thank you very much. And the only other action item we have today is the captioning service procurement, and Jason will explain, and we do need a motion for approval.
Okay, so one of the recommended strategies in the approved communications plan from 2 months ago was to caption all of our videos so that they would be more accessible. That's not only improves accessibility for those with hearing impairment, but also for those who do not speak English as their first language, because accurate captions on YouTube will allow them to have the captions translated through YouTube so that they're actually able to, in a caption, see the conversation in their language. So this creates greater accessibility for multiple populations. And we did one in-house to see how much time was involved with it, and determined that it was not likely cost effective to do that from a staff route. And also probably not going to be as accurate if it were done professionally. So we did reach out to a few vendors and did some research here to see how much that would cost. And you'll see a very detailed report in the meeting packet. There's probably more details than you would necessarily like to have, but I wanted to make sure that you had all the details. And essentially at the end of the day, there's a company called Rev that is being recommended. They have a good reputation and they were also the most cost effective and have good turnaround times so that we can get, like a meeting like today where there's great consequence and importance to the community, that this not be, a 2-week lag time on getting this captioned appropriately, but maybe more like 48 hours to get it captioned appropriately. So essentially, the recommendation is to use Rev and to authorize spending of up to $1,500 for this fiscal year. That would allow for captioning all of the past meetings and captioning all of the future meetings for the rest of this fiscal year. And that includes not only the board meetings, but also the grant seekers meetings and any other recorded YouTube meetings that we have and publish on YouTube.
So we don't have anybody doing sign language in the background.
Sign language was recommended for live events such as a press conference, but not necessarily for like a board meeting.
Okay.
Yeah.
I wasn't sure we'd have some guy on the side going.
I think we do recommend that for the press conference
Okay.
itself, where it's not going to be auto captioned in real time.
Okay.
Yeah.
Okay, so we would need a motion for approval of this procurement. Danielle moved. Tim seconded. Any discussion? Bill. You're on mute, Bill.
Sorry about that. Jason, I believe, mentioned referencing, and I don't necessarily need specifics, but you did mention that you had reached out to others who had used this service and had received quite favorable referencing.
We looked at online reviews, not specific community partners.
Okay.
I'll say,
Danielle.
like, I've used it for NAMI and they do really quick, good work. So.
Oh, great to know.
No, there's our community person. I go Danielle, all right.
Okay, I will take roll call. Mary Ann Abadi, aye. Dick Kunert,
Aye.
Dr. Edward Copeland, Danielle Angeliri,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Terry Giardini,
Aye.
Tim Neighbors,
Yes.
and Linda Sandquist. Moving on now to discussion items. The board member profile development, and Jason.
Sure, a number of board members have asked concerning the resignation of Dr. Morris, have asked kind of about the different appointments, and I think there was some perception that each board member was appointed like for some specific interest, like education, early childhood. So I did go back and review both the ordinance and the Community Mental Health Act. And really, when the board members were appointed, none of them were designated as a specific type of appointment other than Dr. Gorski, who was highlighted as the MD appointment. But nobody else was designated as a specific type of appointment. And reviewing the Community Mental Health Act, there are referentially types of designations, but it's not dictated, like a checklist. You have to have this, that, except for the county board member. It is, one county board member or one member of the municipal government authority. And then the rest are just more referential, like kind of examples of types of interest that could be considered, such as local health departments, medical societies, local comprehensive planning agencies, hospital boards, lay association concerned with mental health, developmental disabilities and substance abuse, which is not relevant to the tax for our particular board, as well as the general public. So I wanted to clear that up, but also ask that board members would send, from your own experience, any characteristics or qualities that you find are make for a good board member based on your experience over the past year or more of being a mental health board member, and perhaps also any characteristics or qualities that might make for a good board member that may not currently exist on through the designated appointees of the current board, so that we could create a board member profile that could be perhaps submitted to Chairman Shirelli as the board's experience of what makes a good mental health board member as he considers new appointees.
And remember that with everything Jason just said, on top of that, we have to consider part of the profile would include people that are not on boards of agencies that may potentially want to ask for funding or employed by. So, you know, in considering the profile of the individual, you really can't, you know, subtract those that criteria from the profile either. So I just wanted to remind all of you, when Jason would love the input, and I think the chairman would appreciate, you know, knowing exactly what our gaps are in terms of representation, and but we have to consider, you know, the extenuating circumstances we have to be aware of too, so to be a board member. So I just wanted to point that out. Okay, any other comments on that? All right, Jason, did you have a time frame that you needed that input or request fulfilled?
I do not. I think maybe it would be worth a follow-up conversation with Chairman Shirelli to ask him what his timeline is looking like.
That would be great. That would be helpful.
I have one question, Mary Ann. I
Yeah.
wonder, is the chairman looking to us for characteristics or specific name recommendations, or both?
I don't know that he's requested us to give any recommendations at this point. We just wanted to be able to offer that up to him. But because if he does have a time frame in mind, then, you know, we may have to give our recommend, if he is open to a recommendation from us, then, you know, we would know how long we could take in deciding on the profile of what we need. So
Right.
that's all I know right now about that. Moving on now to our second, actually the only other discussion item we have today is the Senate Bill 2278 legislation update. And as we discussed at our last board meeting, that there was this pending legislation that would connect the mental health board to the actual sales tax law directly by, you know, giving the mental health board the authorization to disperse the funding as we are doing today. But, you know, the original ordinance or the resolution, and even the original law, the sales tax law, does not specifically do that. Senator Stadelman took it upon himself, and I know Paul Oakley and David Gill both testified before the Senate, and it was approved unanimously, bipartisanly, obviously, And so they accepted the rule change for the language in this bill, which is you have it in your packet that you could refer to the language that was approved by the Senate. And tomorrow it'll be taken up in the House. And I know that Jason sent everyone an email yesterday. You can slip support for this particular bill in the House, because I will tell you, both in the Senate and in the House, our representatives and our senators really look to see the support from their the communities. So I hope that you take the time to do that. I've already done that myself. So Jason, do you or Dick have anything to add to what I explained?
Only as a matter of detail that it's not in the packet, but.
Oh, it isn't.
The email that was forwarded from ACMI has a link.
Oh, okay.
That you can follow to.
The language.
See the language, yes.
Thank you.
It's called file a witness slip. That's it, Jason, that I'm looking at?
Yes,
Yeah.
that's exactly what it is.
Got it. Thank you.
I've never done that before. Does it work?
Yes, it does. I can promise you.
I mean, it gets their attention, huh?
It does. It, you know, I think it's real important to do. And if you're not, if you're opposed, same opportunity. But yeah, so.
Gotta love democracy.
Yeah, and they give, you know, the ACMA gives all the instructions within that email, so it's easy enough. So moving on to other matters, I have nothing under other matters, unless Jason, anything?
Well, I'll note, you know, there was another attachment in the email that referenced a 3-tiered communications plan. So today there will be email updates sent out and a press release sent out. In June, there'll be like a press conference. So once the actual agreements are signed and we know that what we've proposed to fund will actually be funded, that we host a press conference to announce all of these great programs and talk a little bit more about them. And then also create a landing page on the website where there'll be descriptions of the programs and links to the organization's websites, so you can find out more about that, or how you would even, you know, if somebody were looking to get a referral to that program, that they could find that on the agency's website. And then Tier 3 would be strategies for July, August, and September to do some direct community engagement, to go out to various networks and do some presentations and talk about these programs, and include board members. Not suggesting that's an activity for me alone. We'd love to have different board members come with to different organizations and networks and share the great work we've done and all the excitement around some of these great programs. And also would like to do a video that we can put on the website that talks more about the programs and the process. So for those that, you know, don't get a direct presentation, there's a place where any community member can see that information in a kind of condensed format.
And that is, I think, really a commendable communication plan that we can look forward to, and really, you know, keep the message loud and clear that, you know, what is going on in Rockford right now in Winnebago County, mental health is alive and well. And what warms my heart more than anything, thinking of the recipients that will have just substantially increased opportunity to access mental health care and substance abuse in a crisis, just day to day, for counseling. This is, it's going to be monumental once these programs are all up and running. I think we should all be very proud the accomplishments. And also, I just want to, reflect back. I mean, it does take a village because, from the legislation to the county board approving the referendum on the ballot to the voters, 64% of the residents in Winnebago County approved this tax, and 18 proposals. I mean, it just, the stars have been aligned, and it is just amazing. That's all I can say. Dick Kunert and I had the opportunity to kind of just go back and forth yesterday. He's been in public mental health 51 years. I'm only 41 years, but it's just, it's amazing what is going to roll out. And thank you all. That's all I can say. So.
Well said, Marianne. And we'll continue to roll out.
I know, that's the exciting part.
Mhm.
Exciting for the community. Anyhow, I will
I
ask.
needed that, Marianne.
Pardon me?
I needed that because I'm just one of these guys that's never content. But you got to stop and smell the roses.
You really do.
Absolutely.
But we need
yeah.
that never content too, Jay. We need that.
Well, I'll supply that. Oh my God.
Gotta have it.
It's
Gotta have it.
horrible.
Couldn't happen without all of you. So
That's why you got that bear shirt on, Jay, because you're never content.
That's right, man. I'm telling you.
I got a quarterback, maybe.
Maybe.
Watch my White
That's
Sox.
your positive thinking,
My
Jay.
White Sox too, Jay.
Okay. Well, I will ask for a motion for adjournment
So moved.
Second.
on an historic day. Okay, I'll take the roll call. Marianne Abadi, aye. Dick Kunert,
Aye.
Dr. Edward Copeland, Danielle Angelari,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Carrie Giardini,
Aye.
Tim Neighbors,
Aye.
and Linda Sandquist. Thank you again, especially Jason, for all the hard work and all the organization that you have pulled together. Yeah, I think we
Sure.
can.
Yay.
I'm buying him coffee, don't worry. It's okay.
Okay, see you all.
Thanks, everybody.
Bye.
Thank you.
Take care.